Fill in blank. If you're planning on traveling anytime soon, feel free to consult a pharmacist for all the do's and don'ts. That's very important. Joining us right now, Sajjad Giby is a pharmacist with the Shoppers Drug Mart. Hello, good to have you back on the program.
Thank you.
Your location specifically?
So Bank and Heron.
Yeah, busy
Yes.
time of year?
Yes.
Yeah,
yes,
a lot of people are traveling. Now, I understand that Canadians aren't getting expert consultations before they travel. They just sort of do it themselves and think that they've got it covered.
Yeah, so we've seen a shift now. Canadians are relying less on travel agents and more in favor of booking online and vacation planning themselves. So this does, depending on the destination and itinerary, put you at a little bit of an elevated risk for certain conditions.
Okay.
So many people don't realize that the Shoppers Drug Mart pharmacist is a great resource for travel health advice and planning, and we're there to make sure that you have a healthy, safe, and fun vacation.
Okay. Canadians don't realize that pharmacists are available, perhaps.
No, yeah, they do not. That's true.
Yeah, because sometimes they just think they consult with a pharmacist once they've already got a medication, or they just want to talk about the medication itself. But people can walk up to you and say, I need help figuring out what I should take to travel.
Yes, yeah, absolutely. So it's one of the many services that we offer. We typically will assess based on the destination what travel vaccines you may require. In many instances, we can actually administer those in the pharmacy ourselves. And review with you your prescription medications, make sure we have a comprehensive list for you, recommend some over-the-counter products you may want to take with you, and just ensure that you have everything you need for your vacation.
Okay, that's why you're here, because you brought some of those items. Do-it-yourself planning, it's so essential to keep yourself healthy, consulting with the pharmacist, and then you end up with some of these products. Maybe you can talk about some of the stuff that people are or should be bringing.
Yes, so the products that I brought today, these are ones that I routinely recommend to a lot of patients who are traveling. I want to start with the Gravol because, of course, you may need this while you're on the plane. It's great for motion sickness, great for seasickness if you're taking a cruise, and very versatile overall for any kind of nausea. We have Tylenol for headaches, muscle aches, fever, pain. We also have anti-diarrhea medication. Of course, hopefully you don't have to use it, but it's there in case you need it.
Okay, can I ask a couple of questions?
Of course.
So if we go back to Gravol,
yeah, certainly.
Now this sometimes has a drowsy effect as well.
Absolutely.
So there's a kind of Gravol that you can take that doesn't give that effect?
There is, yes. It's a natural source ginger Gravol.
Is it just as effective?
It depends on the circumstance. Personally, the Gravol, which is the diamond hydrogenate, tends to be a little bit more effective in terms of controlling nausea and for motion sickness, but both are viable options.
Okay, and the diarrhea a supplement or medication, how do you know when you should take that? Because I understand you should probably take it once you have diarrhea, but let's stop the diarrhea before it happens, shall we?
Well, as soon as you start to experience diarrhea or loose bowel movements, it's a good idea to start taking it, and it's important to stop taking it once it resolves, because obviously you could have the opposite effect.
Okay, because diarrhea, never a good time.
Never a good time.
Okay. Continue with the amazing products that you brought.
Yeah, sure. So we have an anti-allergy medication. This is good for any kind of minor skin irritations. If you have mild food sensitivity, you could take it in that circumstance. Bug bites, mosquito bites will help with the itchiness.
So once again, should you take that in advance before a bug bites you?
No. It's definitely something you want to keep with you and make sure that you stay prepared. And part of the reason we include this usually as a product that you would want to take is because you never know when you're going to need it. So.
Okay, fair enough.
Yeah. We have the Hydrolyte, which is an oral rehydration salt. This is great for if you're traveling to a warmer climate where you may have a risk of dehydration. It will help to rebalance your electrolytes and ensure that you're well hydrated. Some first aid kits, bug spray, and we have sunscreen. You routinely recommend at least SPF 30 or higher, and I've brought with me here 2 examples of SPF 50 plus. And lastly, hand sanitizer. This is a great product here. This one clips right to your bag or to your belt, and you can take it with you on the plane as well.
Okay, and that's super important because those germs seem to be everywhere. So you should be applying that hand sanitizer pretty much every hour or so, really.
Yeah, certainly, as often as required. You don't want anything to get you sick and ruin your vacation, especially if you're spending a lot of money to go somewhere. You want to make sure you have a good time. So.
Okay, so these are all over the counter?
Yes.
Now, is there anything that, because I know sometimes the pharmacists keep things behind the I guess the little wall, the little service area, because there's some stuff that maybe a little more powerful?
There are a few different products which we do keep behind the counter, and in some circumstances we would recommend it, again, based on your itinerary and destination, and would definitely be something we would discuss during a travel consultation.
Okay. Is it difficult to get a travel consultation?
No, it's very simple. You contact the pharmacy directly and just let them know. They can book an appointment for you, and often it could be even within the same day or a couple of days. The best advice I would give is the earlier the better. Some vaccines, if you are requiring them, do take a few weeks to take effect. So ideally, you'd want to finish your vaccine course 6 to 8 weeks before you travel. But even if you're leaving sooner than that, it's not a problem. We can always make recommendations for what would be best within the available time frame.
Okay, with 10 seconds left, what's the #1 thing you should take with you?
Sunscreen.
Sunscreen?
Sunscreen, because you may get burned immediately. And the rest of the products you could hopefully get if you require them, but sunscreen for sure.
Sajjad Giby, pharmacist, Shoppers Drug Mart. Thank you very much.
Thank you so much, Dylan.
Wonderful tips. More Daytime coming up.